and I go out, I don't take any precautions. I'm simply coughing and coughing. So that is where the microorganisms, they can go up till the distance of 6 meters in the form of infection granules. So that part droplets. So that part we have to understand. So that is environmental contamination. Another part is also taken care of, compounded by our animals also. That part also we have to keep in mind. But then, once they are there, and also overcrowding plays a very, very important role. Like the study pointed out, in slums it is more because you see, we find that floor area per person is very, very less. So that part also we have to keep in mind. So any infection, if we are not taking precautions, and like let's say cough with expectoration, we are simply coughing. We are not taking any precautions. So environment is also bound to be contaminated. And also in hospitals, you can say we do have a specific this thing bed distance between the two beds and all
Okay.
that. And within that, if there is no hospital infection control, again, it is very important. The organisms are going to spread, through the environment. How they spread from one person to another. Sometimes we may not cough directly onto another person, but the organisms are there in the environment. So hospital infection control is a key pillar also of also taking care of the person and preventing the other person within the hospital to prevent infection from that
Okay, madam,
perspective.
for the benefit of our general viewers, we are talking about superbugs in air. Can we break it down for our viewers? What are these superbugs? How did these superbugs came into existence? People went to treat themselves to hospitals, and suddenly, how did hospitals become site of superbugs?
See, I'll tell you one thing that as I was telling you about example of Gangaram Hospital, the person suffered from urinary tract infection and then they found after culture that there was E. coli infection and they tried nth number of antibiotics which did not, and the organism did not respond. So they gave it as superbug. That means they're not responding to the antibiotics, even to the high grade of antibiotics. So that is why we have to see that, and also particularly during surgical procedures and all that, when we say, and the wounds are bound to get contaminated, and they do not respond to any of these antibiotics. So commonly used antibiotics, that's why I said, brought the name of, people even went up to the stage of vancomycin and all that. So now there are very few antibiotics left, but superbugs in simple words for a common man means that our organisms, they refuse to respond to any of the antibiotics. That is important.
So, madam, what are the precautions which people will try to play out the bite of the Prime Minister? Prime Minister spoke on this misuse of antibiotics, but India has this practice. It's not there in America, it's not there in other countries. Off the counter ability to purchase antibiotics, madam. For some, it's a poor country. Everyone can't go to doctor; they can purchase. It's a double-edged sword. But then you also end up misusing. It's like for everything people take Norflox TZ, which is a very powerful antibiotics. I have seen doctors would not prescribe that for a general ailment. They would prescribe an antibiotic with a lower grade, not that as if, or for example, Augmentin 625, which has become almost a norm, I have noticed in various practices, whereas it's a very powerful class of an antibiotic. So in context of social medicine, practice of medicine, in this country, how do you see that, ma'am?
See, one of the important things which you have to remember, that even pharmacies are not supposed to give this. This is
Really?
not supposed to be available over the counter, but our pharmacies are smart. They have kept one of the doctors on their panel, so they will give that and they will get the signatures of the doctors. So that part is also, so there has got to be very strict monitoring of the drug
Okay.
inspectors on these shops also. But first of all, awareness has to come from within. When PM spoke, about this antimicrobial resistance, the fundamental thing was, in a simple word, how can the message reach to a common man? So, not to become your own doctor. Number two is, own doctor also means going to the pharmacy and telling, मुझे tetracycline चाहिए, मुझे augmentin चाहिए, मुझे norfloxacin चाहिए. So do not become doctors of self. And similarly, pharmacies have no right to become doctors of themselves.
Okay.
So that is where we need to have, correctly prescribed drugs, so that, which can be given in correct dose at right time and at right, if it is really required. Because we find that half of the infections are only viral infection, more than half. which will subside by themselves.
Absolutely, ma'am. I'm also joined by Dr. S.K. Singh, former Director, National Center for Disease Control. Sir, this superbug story, it's very, very worrisome. Your opening comments, sir.
No, I think you have raised a very, very pertinent question. And particularly when the superbugs, we find antibiotic resistant genes in the air, polluted air, to which we all are exposed right now in Delhi and many other cities in the country. So I think we need to have a deeper look into that. The causes lie in the humans, causes lie in the overuse, misuse, disuse, and rather than having the antibiotics prescribed by the doctors, as Madam has rightly said. But we have n number of ways in which antibiotics are being used rampantly, not only in the human sector but in animal sector also. Pharmacies are discharging polluted antibiotic contamination in the environment, and we look at the environment in which to which we are exposed. We are finding these resistant, and when we look at the air polluted, they PM 2.5, that is the one which is affecting our lungs. So when our lungs are affected, they cannot respond in a normal way. In the normal defense of the body, cannot respond to the infections in the normal way. So our defense system gets weakened, and that prolongs the hospital stay. That limits the use of the antibiotic, as you might have seen in the article by itself. Many of the antibiotic trimethoxam and many antibiotics are now becoming the bacteria, staphylococcus, pseudomonas. They are becoming resistant to that. That resistance is being monitored by the national program, AMR program, by the National Center for Disease Control. So that resistance pattern needs to be communicated not only to the clinicians, but also to the pharmacist also. And because the cause lies from the community to the pharmacy.
Dr. Singh,
Yes.
how can this be propagated that invention of antibiotic was one of the biggest breakthrough in medicine globally? It not only allowed people to survive but prosper also. Suppose we lose our power on antibiotics, then what will happen?
No, you are very right, because there have not been much invention or the research on the new molecule finding. A lot of scientists are working on that, but in last 3 decades, so many other drugs have been discovered by researchers, but not many new molecules have come
Yes.
up. So when we have limited number of molecules, there is a problem of AMR, and then we have to use the already available antibiotics in a very judicious manner. If we keep the antibiotics out of circulation for a period of 10 years or 20 years or so, like what we have seen in tetracycline. Tetracycline went out of the use, and now again we find that the bacteria has become sensitive to that. So that particular methodology has to be adopted not only by the industry, clinicians, but also by the community. And as Madam has said, red line campaign, like the pharmacy, everybody has to play their role. Not only community, pharmacy, doctors, and we ourselves also. Like you have raised a very pertinent question. These type of questions or these type of programs should be done in a very, very large scale. Otherwise, next pandemic which the country or the world is going to face is going to be the pandemic of the AMR or the bacteria which.
Absolutely, 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 sir. I completely agree with you that unless and until there is some sort of sensitization of this issue, unless and until people are told that if they misuse antibiotics, they will be in a problem, because there is no further invention of better antibiotics that is taking place. Prime Minister Narendra Modi spoke about it. Prime Minister Narendra Modi spoke about the misuse of antibiotics. At the end of the show, I leave you with the bite of Prime Minister Narendra Modi, who spoke on this issue and has warned people not to misuse antibiotics, because the special show is telling us the data which has been researched by the JNU, that there are superbugs in air. So imagine if you have microplastics in air, if you have superbugs in air, then we are really looking at a medical crisis, and this can only be combated at the level of the society. So thank you very much for watching my show, and I end this show with the bite of Prime Minister Narendra Modi.
आज मैं एक ऐसे मुद्दे पर बात करना चाहता हूं जो हम सभी के लिए चिंता का विषय बन गया है। आईसीएमआर यानी इंडियन काउंसिल ऑफ मेडिकल रिसर्च ने हाल ही में एक रिपोर्ट जारी की है। इसमें बताया गया है कि निमोनिया और यूटीआई जैसी कई बीमारियों के खिलाफ एंटीबायोटिक दवाएं कमजोर साबित हो रही हैं। हम सभी के लिए यह बहुत ही चिंताजनक है। रिपोर्ट के मुताबिक इसका एक बड़ा कारण लोगों द्वारा बिना सोचे समझे एंटीबायोटिक दवाओं का सेवन है। एंटीबायोटिक ऐसी दवाएं नहीं हैं जिन्हें यूं ही ले लिया जाए। इनका इस्तेमाल डॉक्टर की सलाह से ही करना चाहिए। आजकल लोग यह मानने लगे हैं कि बस एक गोली ले लो, हर तकलीफ दूर हो जाएगी। यही वजह है कि बीमारियां और संक्रमण इन एंटीबायोटिक दवाओं पर भारी पड़ रहे हैं। मैं आप सभी से आग्रह करता हूं कि कृपया अपनी मनमर्जी से दवाओं का इस्तेमाल करने से बचें। एंटीबायोटिक दवाओं के मामले में तो इस बात का ध्यान रखना बहुत जरूरी है। मैं तो यही कहूंगा, मेडिसिन्स के लिए गाइडेंस और एंटीबायोटिक्स के लिए डॉक्टर्स की जरूरत है। ये आदत आपकी सेहत को बेहतर बनाने में बहुत मददगार साबित होने वाली है।
This isn't a trail of peace. This is pressure overload. A hill built for 1,000, forced to carry lakhs.
Instead of lightening the footprint, you have allowed people to actually get into every nook and corner of the Himalayas.
Careless travel, choking hills.